listening to your member station, WHRV.
Support comes from the Hampton University Proton Therapy Institute, providing non-invasive cancer treatment that spares healthy tissue with minimal side effects. More at hamptonproton.org. Live your life. Let the Hampton University Proton Therapy Institute fight your cancer.
Support comes from the Barrier Island Center on the Eastern Shore, celebrating its 20th year at Art and Music on the Farm, May 28th, with gospel and bluegrass, over 40 artists, wine, and more. BarrierIslandCenter.org.
Join us to honor and remember our troops, our veterans, and our military families.
National Memorial Day Concert.
Join me, Joe Montana.
And me, Gary Sinise.
With Gene Smart, Gil Birmingham, Mary McCormick, Dennis Haysbert, Leah Salonga, Norm Lewis, Craig Morgan, Rhiannon Giddens, and Brian Stokes Mitchell.
Join us for a night to remember.
The National Memorial Day Concert.
Sunday, May 29th at 8 on WHRO TV 15.
Today at noon, it's Another View. Cardiologist and Medical Director of Health Equity for Centera, Dr. Keith Newby, will be on the show. Tune in to hear what we can do to ensure that everyone has access to quality, affordable, and equitable health care. That's today at noon right here on WHRV. It's 1020. Support for NPR comes from this station and from C3AI. C3AI software enables organizations to use artificial intelligence at enterprise scale, solving previously unsolvable problems. C3AI is enterprise AI. And from DuckDuckGo, committed to making privacy online simple. Used by tens of millions, they offer internet privacy with one download. DuckDuckGo, privacy simplified at duckduckgo.com.
I'm Jen White. This is 1A. We're discussing the decline in childhood immunization rates nationwide. With us is Dr. Carl Lambert, a professor of family medicine at Breast University's Medical School, and Dr. Paul Offit at the Children's Hospital in Philadelphia. We're going to add a new voice. Dr. Umair Shah is Washington State's Secretary of Health. Dr. Shah, welcome to the program.
Thanks for having me.
We'd also love to hear from you. How do you feel about childhood vaccinations? Do you keep up with your own routine shots? We got this voicemail from Kate.
I have two children, both daughters, a 6.5-year-old and a 4.5-year-old. If anything, the pandemic has stressed to me the importance of keeping our children as well as ourselves up to date on all physical examinations, well child visits, dental examinations, eye examinations, and of course our vaccines. I'm a believer in science, a believer in doctors, and I work with our pediatrician to make sure that we are on the schedule from the APA. Thanks so much.
You can add your voice to the conversation. Tweet us at 1A or send us an email at 1A@WAMU.org. Dr. Shah, Washington State released its data on childhood immunization rates last week. The overall rate for routine vaccinations declined by 13% last year. That's compared to averages between 2015 and 2019. What do you think has led to that decline in Washington specifically?
Well, Jen, first of all, thanks for having me, and it's great to be a part of this panel. I would say that as you were just hearing that, this pandemic has been difficult for all of us in so many different ways, and whether it's the virus and the pandemic and fighting the pandemic itself, or the policies that have been put in place, or just the fact that people avoided being in the healthcare system, staying away from their pediatrician in the case of childhood vaccines or primary care provider. All of that has contributed to this decline. And one of the things about Washington, our state, is that we've been very upfront about putting that information out there. But I suspect, as I know your guests have said as well, that this is a national phenomenon, unfortunately, that we're seeing across the system.
Now, the sharpest decline was among children who are 19 to 35 months old. Why is that a particularly vulnerable age group for this decline?
Well, as you can imagine, I mean, this is an age group that is susceptible to a number of childhood vaccine preventable diseases. So it's that, and the fact that that's a really important time for our children to get vaccinated. And so when you see any delay or any hiccup, if you will, in interruption in a whole cadre of children or parents of those children seeking the vaccinations or vaccines for their kids. That's a real problem, and it's not just a problem that we've got to then catch up on, but it has ramifications for disease. And so that's really the biggest concern that we continue to have.
We got this email from Sue who says, I am old enough to have had measles as a small child in the Philadelphia area, and I still remember how sick I was. High fever, pneumonia, I had it all and nearly died. Parents who refuse to vaccinate their children do not have any understanding of the risk they put their child in. Dr. Shaw, right before the pandemic, Washington had 2 measles outbreaks. If these rates don't catch up, how prepared is your state for more potential outbreaks like the ones you saw in 2019?
Well, I came to Washington from Texas, and, I will tell you this is, again, giving you a 2-state perspective, whether it's Washington, whether it's Texas or beyond. We've continued to have outbreaks. The outbreaks are very much centered on where you have vaccine hesitancy or reluctance or gaps, right? And so when those gaps are in place, so for measles, we know that it's really important for community immunity to have a cadre of children who are vaccinated, adults who are vaccinated, so we can protect those around us as well as ourselves. And when we are not seeing that, or you have any change in that percentage of children or adults who are vaccinated, you start to see an erosion of the very protections that we are looking for. So yes, in 2019, the measles outbreak in Washington was looked upon across the country. I will tell you that we've had outbreaks across the nation in all states, if you will, from this real concern about parents not getting their kids vaccinated. And so this is the implication that we have, right? In the middle of COVID-19, you've had a whole campaign that all of us have been engaged in, myself included, about getting people vaccinated, the importance of boosters, the importance of really making sure that you're taking care of your overall health. And in the midst of that, you've had misinformation, disinformation, you've had a targeting of certain communities as well with that misinformation. And so now you have parents who at some point are either confused or may just say, you know what, I'm going to wait. And that waiting is dangerous when it comes to children who absolutely need to have timely vaccinations.
Well, that takes us to this email we got from Mary Schneider, who says, I do have a fundamental issue with giving infants vaccinations in their first year. My question is, how do you propose to support these babies in developing a healthy, robust immune system? As I understand it, childhood diseases and recovery allow an immune system to become healthy and strong. This translates into a child who can use their own system to overcome numerous diseases and other health issues. Dr. Offit, how would you reply to Mary?
Well, in some ways it's true that if you're, for example, naturally infected with measles, you develop an immune response, meaning antibodies in your circulation, that's probably 3-fold greater than what occurs after vaccination. The problem is that you pay the price that you pay for natural infection. I mean, before there was a measles vaccine, every year 48,000 children would be admitted to the hospital with measles, and about 500 would die from measles. So that's a high price to pay for natural immunity. And the fact of the matter is, the immunity that's induced by vaccine, if we're using measles as an example, is good enough. It was good enough to basically eliminate measles from this country by the year 2000. The goal of a vaccine is to induce the immunity that's a consequence of natural infection without paying the price of natural infection. That's what vaccines do. It's never a good idea to try and risk natural infection knowing that the consequences can be permanent harm or death.
We also got this email from Rachel, who says, when doctors prioritize chickenpox in the same way they do the polio vaccine, it rings hollow to parents who have lived through chickenpox and know it is not as devastating as polio. We feel like someone is pulling the wool over our eyes, and yes, my defenses are up, and my trust for the whole medical establishment goes down. Dr. Lambert, have you run into this in the patients you treat?
Yeah.